Hello, this is Dr. Leo Kormanik with Running Rehab. Basically, here in this video, we're going to go over some cupping stuff to do for the Achilles. Before we get started, let's talk a little bit about the Achilles itself and the different type of injuries that can happen. These cupping mechanisms are not to be used during an acute Achilles inflammation, meaning, say you go for a run and the Achilles flares up, it's actively inflamed, it's swollen, it hurts to touch, and you can't even start a run. Do not do these mechanisms for that. This is more meant for a tendinopathy, kind of like a chronic tight Achilles, a little bit more sore at the start of the run, but loosens up as the run goes on. Kind of your more aging Achilles kind of thing, so a little bit more of a veteran runner sort of thing. That's where this really excels. You don't want to do all this cupping when the Achilles is actively inflamed and it's clearly inflamed and sore to touch. Okay, so that's very clear. So basically, with this, you want to make sure that you're working the area of the Achilles that's sore, but you also sort of want to make sure you're working the tight part of the calf as well. So basically, all the tension up here in the calf is really what determines the actual restriction down in the Achilles. And so you can literally just kind of go through the Achilles and just feel what area is worse and just kind of take a mental snapshot of that. And so basically that's the area you're going to go after. Now, the different cups we're going to use, like some of these cups have contours, some of the cups are smaller, some of the cups are bigger, and I'll put a link in the section so you know which ones to buy, because this is really a good brand. But basically, what we're going to do here is we're going to just kind of start like surveying the area. So you're just going to do a couple inflations, just get it nice and tense, and do some ankle motion back and forth. And then you can kind of see how it gets contoured at the top end there, get a nice little release. Okay, and we don't need the cups on there more than 5 to 10 seconds. A couple of different motions. And then you want to pop off, get to a new area. And then this is sort of an active process to get it to release. You don't want to put the cup on there for minutes on end. That's completely non-functional. What you want to do here is you want to get the cup on there and force the tissue under the cup, so that way you're getting the actual movement. So that way when you go run and exercise again, the movement is much better, which is clearly what you're looking for. So again, I'm just working up and down the Achilles, and then just kind of getting both inside and outside to release. Okay, so again, that was sort of the contoured cup. The contoured cup is also cool because you can get it right on the backside, directly on the backside of the Achilles, right through there, and then you can really see a good release right on that spot. Like I am directly on where the muscle blends into the Achilles. A very sensitive spot, but very powerful release. And then if you want to get really into the belly of the Achilles, you want to roll your foot up like this to kind of smash the Achilles a little bit in the ankle. Then get a nice hold on it. Keep the pressure on the cup as you're lengthening out the foot here. And again, you can see the contour of the Achilles popping up there, where the Achilles is sort of stuck to the sheath. Getting this release right here is really critical for nice Achilles release, especially when the tendon is irritated, like in tendinopathy. This would hurt like crazy if you did it on an actively inflamed Achilles. So do not do that. This should be like just like an appropriate amount of discomfort, like maybe a 1 or 2 out of 10, maybe a 3, but definitely not above a 4 or 5 out of 10 on the pain scale. So again, a really good release happening there. I feel tons of pressure and pull into the Achilles, but no pain, really. So not much pain at all there. So, and I got a nice good release right through there. Obviously, being smart, we want to move up to the actual calf itself and getting a release into the calf. You want to think of the calf in 3 different ways: outside gastroc, inside gastroc, and soleus in the middle here. All 3 of those muscles provide most of the tension to the Achilles, so you want to make sure you're working all those areas. Some people will actually get some irritation in through where the peroneals come in on the side towards the Achilles, so you can start to work the margins of the peroneal on the side. So you kind of just want to like fish around, move the area, and just kind of see where the tension is. You can see right there I'm getting really good release in the peroneals where it inserts in the soleus. Look how red that is. So that's a really good release on that spot. So for me, that's an area that I kind of want to hone in on. Okay, I feel a lot of really good pressure there. So some good stuff releasing. For some people, it might be more on the inside, so they might have to come up more on the post-tib, on the inside part of the ankle, the posterior tibialis, and then get a nice release on the soleus where that meets with the Achilles down here. Okay? And then, lastly, you can take one of the smaller cups and actually get on the insertion of the Achilles and start to work the margins of the insertion. See, I'm directly on the bone. So where the Achilles kind of blends in into the bone here, into the fascia on the calcaneus, I'm actually getting directly on that spot and really getting a good release. And you want to work the whole thing, so that way the tendon can just totally release from top to bottom. And again, you can see here, if you get it right, you can get it right on that spot. Now, it takes a little bit of practice for sure to do this. You know, I probably do thousands of cups a day on people, so it's obviously pretty easy for me to sort of maneuver around here, but it's important for everybody to sort of understand how this works. See, that's a really good hold there, so that way they can treat themselves and get these areas to release really well. Because it's much easier for people to do this on their own than it is to come into a provider all the time. Cool? So that's a big release there. Now another really good move you can do, you can kind of get your foot back to here, and then you can do on the actual insertion all the way down, you can do one of those contoured cups and get it right on there if you have one of those insertional Achilles issues. Okay, so you can basically work right on the insertion, outside, inside, right on the backside, all through the Achilles, all through the margins on either side, the peroneals, gastroc, soleus, and then the post-tib on the inside.